Hi, this is Dr. Tom Rifai, internal and lifestyle medicine specialist and editor for NOTeD, that is News of the Day. On behalf of the True Health Initiative, it is really an honor to welcome Dr. Dean Sherzai to the platform. Dr. Sherzai and his wife Ayesha are experts in the area of dementia prevention, and what a powerful topic. Dr. Sherzai, I will admit to you that there is definitely a personal interest here as well, not just as a metabolic health specialist, and my area comes in terms of metabolic syndrome and diabetes prevention, but in my end of the family, both of my parents suffer from various degrees of cognitive decline. My father had type 2 diabetes and ended up becoming insulin dependent by, I think, his early 50s. I'm going to be 53 soon, so I'm happy to announce my A1C is 5.1 and my insulin levels down in the single digits. But this is work, lifestyle as medicine, which we'll discuss, and my mother as well. But to make a long story short, very professional but also personal interest. And so to start this discussion, I actually would like to ask you, what drove your passion? You have such a passion for this that it really interests us, and I think many people are watching, some of which may be scientists and medical professionals, but many are going to be intelligent lay audience. What drives your and your wife's passion for this topic?
Two different directions. One is like you, it's a personal journey, a personal story. Both of us had two grandparents that suffered from dementia, and we saw them when we were younger, saw them lose parts of themselves, and saw the angst, the agony, the fear, the anxiety. Especially in retrospect, you can recognize those things. It was just devastating. My grandfather and Ayesha's grandfather were both giants. They were just amazing human beings, brilliant people who then, became lesser version of themselves. Not as far as, but as far as memory is concerned, because it's not just memory, but totality. So that subconsciously initially, but later we realized that was the driver. So we took it all full force. We met 18 years ago in our quest to do good, I guess. We are very, very service oriented. So we believe in service-based leadership. We believe in community-based leadership, which is, doing whatever we can to help the population out there. And we met in Afghanistan while we were working to try to help out, me with HHS and World Bank, and Ayesha with Doctors Without Borders. We met in a party, and the conversation was that. The second component was when growing up in Virginia and Pittsburgh, my family is a medical family. They're doctors, 20-something doctors in my family. And we always gathered in this farm we had for the weekends, and we would talk, and that's where I saw my grandfather lose himself. But we would talk about the brain. It's interesting. There were surgeons, there were this and that, and if it was philosophy, it would come to the mind. If it was this, so that was another little push towards cognition and brain. So we took the journey, and we did all the academic paths. Ayesha went to Columbia University. I went to NIH and UCSD, number 1 and number 2, dementia. But we realized quickly that although molecular research is important, so we are not the type to put down medicine and put down research. Those are incredibly important things. We realized that there's a need for prevention, which there does not exist. So immediately we took the path less traveled, and we looked around, and lo and behold, there's Loma Linda, which is a Seventh-day Adventist institution. We called, I cold called and said, I want to create a brain institute here. And we went there, and the rest just followed. Ayesha did a double fellowship, double residency, internal medicine prevention, and then Columbia University. It was wonderful seeing the world just open up in front of us. Like, oh my gosh, there is a whole universe that we were never taught in school, in medical school, in college, which is prevention and the data on prevention and cardiovascular, diabetes, cancer, but not much on cognition, although even that was being done. So we took that path to study that element.
That is a wonderful story. Thank you for that rich history. And at some point, I think in your clinical experience, you realized that there were many, many more people to reach out to, and you decided to write the original Alzheimer's solution.
Correct.
Was there a particular impetus for that?
Yeah, so public health was in our DNA. Ayesha's grandfather was in public health, was a Secretary of Health and Humans in Afghanistan, and my grandfather and my parents and uncles were in the public health. So we knew that the best way to reach people is not the clinic alone. So you have to reach large populations, and you have to do it in a way where you're not dictating, you're not talking down, you're not just throwing information against the wall like it's a social media, state. It has to be at the community level. My PhD is around this concept, which is called CBPR, community-based participatory research. So in the past, a questionnaire would be created in Boston based on 50-year-old men, white men in Boston, and then would be applied to 70-year-old Hispanic women in San Bernardino. And then it wouldn't work, and then it failed. Never realizing that when it comes to change, especially human behavior change, it is literally about listening, but nuance, but that's basically. So that was our interest originally. Even when we came to Loma Linda, we worked 2 days in the clinic. The rest was from our own budget, from our own time, in the communities, in churches and faith communities, reaching out and learning. So the book is just one of the venues of how you can reach out larger populations. And if you look at the details in the book, it's not just about recipes, or it's about behavior more than anything else. It's about how do you inculcate, how do you incorporate habits. It's a habit book. Our second book, which just came out a couple of weeks ago, which is called the 30-Day Alzheimer's Solution, it's got 75 recipes, this, that, but at the core, it's about habit creation.
Yes.
Because without the ability to change habits, it's a forced, contrived, unfit, new diet, new year resolution, new exercise routine will dissipate and go away, and you settle back to your baseline comforts. So that was our interest from the very beginning. That will continue to be our interest. That's our research in the communities. Right now, Ayesha and I lead the largest community-based research program, brain health research program in the world, pretty much, and it's expanding. And so that's the book is just a synopsis of that approach.
Mm-hmm. And I love the way that they integrate real-world stories, so that you can take all of the information that you bring, that you necessarily have to bring in terms of science, and then bring it to the real world. And in that sense, you've created a nice acronym with Neuro. And we're obviously not expecting to get the entire even one, let alone both books here. But if we may start to dig into a bit of what people can take home as action points for starting to prevent, and in the process, probably lower their risk of obviously everything: type 2 diabetes, heart disease, cancer, so on. Maybe it's not all absolutely different, but there are some nuances. You brought up the term when it comes to dementia prevention. But if you can maybe take us through and use Neuro as your guide path to give us just a nice flavor, appetizers, if you will.
So looking at, we're researchers as well, as we publish every year, just submitted 2 massive comprehensive reviews on omega-3 in the developing brain in children and omega-3 in the aging brain. So looking at the data over and over again, it was apparent that there were 4 processes that underlie most diseases, but especially the brain. This incredibly active organ, 3 pounds, 2% of body's weight, yet it consumes up to 25% or more of the body's energy at any one point. That's remarkable. In fact, it does some of its best work at night when you're dreaming, when you're sleeping, cleansing, reorganizing, and all of that stuff. So there are 4 processes: oxidation, inflammation, glucose dysregulation, and lipid dysregulation. And you're a metabolic specialist. They're not independent. They're interconnected. The body works together. But sometimes one of those processes lead. For example, we did a study we published a few years ago on NHANES. It's a very rich database looking at pre-diabetics and looking at insulin resistance. Even pre-diabetics, when not managed, had lower cognitive state. So, and this is not to make people afraid, but actually to empower them. We really literally think, and this is a database driven extrapolation, meaning that it is an extrapolation. There's not direct data, but there's enough indirect data to say this is true, that up to 90% of dementias, especially Alzheimer's, can be prevented. Not more than that. We know that there are 3 to 5% that are purely genetic. Frontotemporal lobe dementia, less so, but Alzheimer's, vascular dementia, these are massive diseases. Right now, 6 million people suffer from Alzheimer's in the US alone. So the story that you have with your parents and your family, and the story that we have, is not uncommon. Almost every family in America and in the Western world actually has a similar story. And so what we're doing is not making them afraid, but empowering them with the tools. And by the way, we're not selling anything. We're not selling vitamin concoctions or biohacking or cleanse tool or none of that. Very simple tools that they can apply in their home. They don't have to buy anything. They don't even have to buy our book for that matter. But it is a comprehensive approach. And if they do it, even if they do it 30, 40%, that's 30 to 40% healthcare change that they wouldn't get in their clinic, that they wouldn't get in their hospital. So that's the underlying thing: inflammation, glucose, all that. What affects those? 4 things plus 1 that we add that's unique to the brain. Nutrition, N for nutrition, E for exercise, U for unwind, stress management. And for us, it's not about bad stress, but it's actually about good stress even more. And then R is restorative sleep, which means just because you're knocked out with the medicine, it doesn't mean you're getting those phases of deep sleep, which is incredibly important. And O is optimizing mental activity, which is creating brain reserve. Brain reserve is immensely important. I mean, we have 87 billion neurons. That's way more than we need for our daily activities. But here's the superpower. Each neuron can make a couple of connections or as many as 30,000 connections each. Of course, different neurons, different, but as much as. Now, that's immense resilience. That's immense protection, because all those connections protect you against all of life's challenges. How do you make those connections? Whereas nutrition, stress management, and sleep give you the environment to build the brain, and you need that. You can't do it without that. Exercise and mental activity, or optimize, O, builds those connections. Now, in a standard American life, or a standard American diet and life in general, only 0.4% of Americans, by American Heart Association values, live a healthy diet. And that's by AHA's standard, which is lower standard. Exercise, very small percentage. Stress management, I don't even have to tell you that, where we are with that, especially with the COVID era. Sleep is absolutely horrendous. The data is anywhere between 40 to 60% have serious sleep disorders. And in one series, it showed that people with sleep disorders have a 70% increased risk of dementia. And then mental activity, here's the nuance. It's not about education, although we use education as a proxy, as a marker of mental activity. It's not about that. It's about keeping your brain challenged around your purpose. We did a meta-analysis, which was published in 2018. And what came out of that is purpose-driven, and we'll define purpose, activities that push your brain continuously throughout your life. When a person is mentally challenged, they're making those connections, they're protected. When they stop doing that after retirement, they have the steepest decline. So there it is. That's it. Those 5 things. Within nutrition, we also include alcohol or lack of it. That's the most important thing. People keep making up these papers about drinking alcohol is good for your brain. We have no idea where that comes from. But very small amounts of alcohol is okay. But we're talking about 1 glass of wine. More than that, there's no data.
Yeah.
No real data. You can always find data, nor validate that. And then smoking, eliminating smoking as well. You do these things. You've protected your brain against stroke. My wife's specialty is stroke. She did her work at Columbia University, one of the largest studies that was published in American Heart Association, California Teacher Study, 133,000 people. Nutrition alone reduced your chance of stroke, the 3rd leading cause of mortality in America, by as much as 50%. I mean, that's remarkable.
Huge.
So that's it. Okay. Daily activities that you can bring into your kitchen, into your living room, into your work, will be more effective for your healthcare than any gimmick out there.
As a matter of fact, well, I wanted to kind of go through and give some specific points for people who might be starting way off in the what we might call what I've called the crap SAD. Now that's CRRAHP, calorie-rich, refined, and highly processed standard American diet. But you mentioned in your book that you really have built the ease to physical activity at work and home exercise equipment right around you. Yeah. So I guess that can kind of start off in the sense that lower the barriers to what you're recommending as much as possible.
Yeah.
In terms of physical activity, you definitely live and breathe that literally. In terms of nutrition, maybe some specific points. You definitely highlight saturated fat, refined carbohydrates, and you may even make some mention of excess sodium as well. But when it comes to those, what are some, imagining that Americans coming from way out here may not be able or willing to go all the way in a theoretically ideal correction. What's the biggest, no pun intended, low-lying fruit?
Yes.
With that wonderful fruit bowl that you have behind you, that people can, and it doesn't have to be fruit, but whatever what are the biggest first steps that people can make in the nutrition in the end?
We believe in progress over perfection, but at the same time, progress must be measurable, attainable, and so it can't be. I hate the word that we detest the most is moderation. Moderation is a word that we use to try to get out of doing things because there's no denominator. What is moderation? I mean, when I was in Pittsburgh growing up, I played all these sports. I ate meat 7 times a day, processed meat. We're talking about beef jerky. What is moderation for that guy? 5 times a day? Is that any better? It's like saying I'm having a bucket of cyanide. Okay, moderation, half a bucket of cyanide. That moderation has got no actionable, measurable direction. Instead of that saying this is the optimal. Optimal is a whole food plant-based diet, let's say. But oh my gosh, nobody's going to go there overnight, or if they don't want to, they don't have to. But they should move in that direction in a measurable way. Before I go there, I want to make sure that we all, including me, I remember myself back then, we love good news about our bad habits. I don't know who said that, but somebody said, I think Michael Pollan or something. So we will find data that supports whatever we want to hear. I mean, 20 years ago, if you would have come to me, I would have found a paper that said bacon is medicine. Bacon is going to cure all cancers, everything. I would have found some paper. But reality is the data is already well known, whole food plant-based. But your first step should be the step that you can do, the step that can be done in a measurable way. So if it's sugar, first of all, truly identify how much you're consuming in a week. So spend some time. Don't jump into the diet, and spend some time how much sugar added, as well as how much sugar in the products that are in containers and all that you're getting. How much saturated fat are you having as added fat or in contain? And then start just with sugar, let's say, and reduce it by 50% over the next 2 months. We didn't get to this point overnight. Don't try to get out of it overnight. So 2 months, that's it. That's your job. Is it specific? It's sugar. Is it measurable? Yes. We said 50% and you already know how much you're consuming. Is it achievable? I think that's achievable. And instead, by the way, also replace, instead of that sweet, use date powder or monk fruit or fruits.
Or fruit.
Fruit. Yes, exactly. Fruit. And then is it relevant to your bigger goal, your purpose in life? Yes. Health. Whose health? That's everybody's purpose. And then time-bound, 2 months. That gives you an achievable, and then once you reach there, reward yourself with a physical check mark on a wall on something, and reward yourself by going to the beach or to a vacation. That is behavior change. That is all those Tony Robbins, this is nothing, all those talks that you pay money for, there it is. That's it. You don't have to go. If every behavior is reduced to that kind of an action, then it can be changed, then you feel good, then your habits are changed, your taste buds change because 2 months gives you some time. Sugar is pretty addictive, so it might take a little longer. And then you go to the next thing if you want to, and the next thing. So that's the best way to do it. Anything outside of that is a diet plan of the week, New Year resolution of a week, which usually fails.
You made a point too that the whole family got involved. I have a saying that sure, you are what you eat, but you eat what surrounds you. And you could
Yes.
see the fruit bowl behind you. So
Yeah.
maybe going back to maybe the way that it's personally done in the Sherzai home, it seems like you set up yourself for success in a sense. So while you might have these goals, what do you do, not just in theory, this may be more the personal question, you make that happen in your own world by, it seems like, I'm going to let you take the baton. How do you how do you modify your environment or establish an environment that makes this kind of mindlessly, no pun intended, mindlessly easy
No.
to do
Yeah.
achieve?
Mindlessly, by mindlessly, you mean not through cortical thinking, but through habits, which is
Yeah.
lower down the
Or that
brain.
your fruit is right there. And I mean,
Yeah.
it's proximal, probably just by reflex, just grab it.
Yeah. I mean, you want to identify accurately the behaviors you want to increase. So this is the behaviors you want to reduce. So with food, let's say you want to eliminate saturated fats, you want to eliminate processed foods, you want to eliminate carbs and refined carbs. And so eliminate those things from your existence because those are triggers. And triggers, if you're able to sustain it with some kind of motivation or something for a while, but under stress, under some situation, you'll go back to that if the trigger is there, especially if you haven't made the alternative your habit. And then increase the triggers that are healthy. So if there's nothing else around you, but there's a tasty fruit, there are vegetables, but if the kids are not very used to vegetables, making a very healthy dip so that they can dip it in there, that makes the behavior much more likely. They've opened the fridge one step, take it out two steps. Reduce the number of steps to the good behavior, increase the number of steps to the bad behavior.
Exactly.
If you need to get out of the house, to get in the car, to get dressed up, to go to a store, to get the bad thing, it is much less likely to happen. And by the way, that period of time, it creates what's in psychology called cognitive dissonance. That discomfort in your head that it will give you time to do that count. Okay, maybe that was a bad decision, and you drive back home. That's basically it.
Mhm.
Making the environment for good and reducing the environment for bad.
And speaking of which, maybe we can weave in a little bit, speaking here about Loma Linda, in terms of blue zones, and maybe a specific shout out to the way too beaten up bean, and how the bean seems to be across all the different blue zones a consistent food choice, and may fit into a lifestyle of dementia prevention. Any words on?
Absolutely. I mean, we have to be very careful. There are a lot of books out there claiming that they can reverse Alzheimer's. No, nobody can reverse Alzheimer's, not at this time. So we were told that if we just hinted at that, we would sell millions of more books. No, it's unethical. It's playing around people's hopes. We were even uncomfortable with the title of the book as it is, Alzheimer's Solution. Maybe somebody thinks that we have the solution for, like, somebody has Alzheimer's. No, it's about the solution for developing Alzheimer's, and the subtitles say that.
Mhm.
So it's critical that we are accurate about what we are pushing. Um, so yeah, the distance between what we're trying to achieve, whether it's the foods or the environment or whatever it is, it's about the solutions that we have around us.
Mhm.
That's basically it.
And do you integrate beans, lentils, peas regularly in the daily Sherzai food intake?
So we have again, we're not about reductionism, but we kind of want to highlight some things so that if people have these things more often, they're going to be healthier. That we call it Neuro 9. And greens, greens. Those are amazing. Those are amazing for multiple reasons, as we know. And if you have 2 to 3 servings of greens per day, you are, really taken care of. Beans, as you said, our friend Dan Buettner has done a great job of highlighting this. I'm sorry, I lost my way there. The books that say beans are bad because they have lectins. There's no science. In fact, the healthiest places, as you put it, are the ones that have beans at the center of their diet. So beans are incredible. Greens, beans, lentils, legumes, as along the same line. Small amount of nuts, making sure that we are careful with that. And that's where we are a little different than others. We bring nuance.
Mhm.
It is easy to give absolutism. The ultimate absolute in health is calorie reduction and eliminating everything, but that's not doable in public health.
Right.
We are not like others. We are public health oriented. We want millions to change. And if we eliminate nuts completely and eliminate olive oil completely, there's no data. There's no and by the way, we don't mean go guzzle up olive oil, like extra virgin oil. We're talking about it in small amounts. So
Hmm.
those are, and then instead of salt, the things that we discovered, which was remarkable, is the amazing curcumin and thyme and all these amazing things that we have for taste that we can add. Most people think that if they change their diet, they're going to be reducing their choices. It's absolutely the opposite. You open up the world to a plethora of choices that are amazing.
Hmm.
So there are things you can eat every day that are anti-inflammatory, antioxidant. They increase your omega-3 cycle, which is lowering the inflammation, the coagulation, which we need to do as we get older. And that's with simple foods.
Hmm.
And most people think that making this change is more expensive. It's not. There are some expensive foods, but you don't have to go there. And it's more difficult, and it's not. It's actually easier because it's simple measure, and the most important behavior they can bring in their home is they don't have to become an expert chef, but learning how to make their own food and becoming familiar with their own food changes life completely.
Absolutely. I mean, well, certainly things like lentils and beans and bulgur are not expensive, and they're certainly not that challenging to make. One of the definitely important items, and I think you certainly already mentioned, and to give you some insight for me as well, you mentioned sleep.
Yes.
And there's obviously a whole lot of, whether it's insomnia and just poor sleep quantity, and then obstructive sleep apnea. You've made it pretty clear that sleep is not just a passive activity. There's a lot of cleaning. And you mentioned that you don't recommend a detox, but I would say I counter, you recommend sleep, which you are now going to explain to us is a detox for the brain.
Yeah. There's a reason that your body paralyzes you for 8 hours of the day, 1/3 of your life. That's not a secure state. Why would it that have been created? I mean, you're literally paralyzed. In fact, there's a state disease process where you wake up paralyzed. It's absolutely horrible, and we've seen patients like that. So the reason for sleep is the brain. The brain, this overly active brain, needs some time to reorganize and clean up. It's a hermetically sealed machine, a powerful machine. It processes 1 times 10 to the 50th power information every few seconds. I mean, that's more powerful than any current supercomputer. So it needs time to clean and it needs time to organize. So the two functions of sleep are putting information and memories into the right file folder and cabinet, metaphorically speaking, and cleaning. And there's a lymphatic system. Glial cells is a system of the brain that are active throughout the day, but at night they become super active and they start cleaning up the brain.
Literally.
Literally. And even the connections that we were talking about earlier, the ones that are not functional, they're eliminated. And all the byproducts of activities such as proteins and amyloid and everything else, inflammatory, are gotten rid of. One night's bad sleep actually has been shown to counter that process. In fact, the amyloid levels go up, the inflammatory measures go up. Now, that shouldn't scare people because if you get regular good sleep, then it does its job amazingly. So sleep is that important. In fact, when somebody has chronic bad sleep, those glial cells that I was talking about earlier, the supporting cells, in fact, they start going awry and they start eating away good brain tissue. That's scary. So that's why people with chronic disease have been repeatedly been shown to have smaller brain sizes.
Mm-hmm.
So sleep is that important. Although medication is useful short term, it's not the answer long term. So things like sleep hygiene and cognitive behavioral therapy are incredibly effective, but over time. That's why we talk about that a lot.
Can you talk a bit about this constant, I don't know if I want to say addiction, but this constant dependency to bright and blue light at night, and how that can affect the brain by allowing this artificial bright and blue light to go deep into after sunset?
One of the elements of sleep hygiene is light, and the other one is behavior. So these two things I want to talk. Behavior, remember habit? One of the big habits we want to create is sleep pattern. So the brain wants to know exactly when it's going to go to sleep and wake up 8 hours later. So make that a habit by just putting that habit in place and not moving those times a lot, your brain will know exactly half an hour before sleep time. That's when the yawning starts, and it goes to sleep. Why? Because the melatonin levels start going up at the right time, and the cortisol levels start going down at the right time, and that creates a powerful triad of melatonin going up, cortisol going down, and the brain being cued to go to sleep. That triad is incredibly powerful for sleep. That's one. So it's important for people to realize that pattern is important. The second is light. Light is the dominant cue for the brain to know when it's time to wake up and to sleep. And even artificial light. For millions of years, we didn't have artificial light, so it was the natural light. So now we've introduced artificial light. And when you have artificial light, that affects your melatonin levels, that affects your cortisol levels. It affects your wakefulness. There's a center behind the eyes where the optic nerve crosses. Behind it is where the brain actually processes the light information and says, I should be awake or I should not be awake. So make sure that at night, the lights start going down up to an hour before. And if you have to wake up in the middle of the night, don't turn on the bright light. There should be a low level light that doesn't wake you up. And definitely at least a half an hour, and that number has to be better delineated. We're very much against just throwing out numbers, but at least half an hour not being on your phone, the blue lights, on your iPad, on all of that stuff. So that's those two factors, just those two factors are incredibly powerful in setting you in motion in a regular pattern of sleep. Just those two things. Mm-hmm. But the problem is, in our standard American life, we all watch TV till the last second. In fact, many people sleep with the TV on. Yes. That puts them to sleep. Lights are never addressed. Timing of sleep is all over the place, depending on what funny show or what good show is on. And so the brain is discombobulated, doesn't know when to sleep, when to wake up.
Is there any mitigation at all? And I'm going to be honest, I hope you say yes. We've eliminated, my family, we've eliminated TV from the bedroom as far as any regular use at all. But I try to max out my blue light filter. These I won't mention brands, but smartphones have blue light filters. Is that even a mitigating factor? Does it help in any way, shape, or form?
There's some evidence. I mean, like we said, that there's weight of data, right? The weight of data is not accumulated enough to speak powerfully to it, but it's enough for me to actually believe that that's the direction, and also at the same time that there's not harm in doing that. So yeah, I'm on the same school path as you. We believe in there is some good to those kind of things.
And in terms of overall metabolic health, you brought back a number in terms of extrapolating the 90%. When we look at the diabetes prevention program, and we saw in that large randomized control trial, those that made lifestyle changes and were able to achieve, and it's not a massive amount. Again, your realistic kind of approach, while the average was 7% weight loss, they achieved 10% by eating, more fruits and vegetables, more physical activity, and found that 4 years later, the reduction in risk wasn't just the average of 58, but 85% reduced risk of developing type 2 diabetes. And is not type 2 diabetes, and while there are nuances, is not there a high correlation between type 2 diabetes and insulin resistance metabolic syndrome, but type 2 diabetes and dementia?
There is, absolutely. Stronger, like I said earlier, even pre-diabetes. We looked at pre-diabetes and enhanced and cognitive function, and because it was cross-sectional, so it was just one time. There was those with pre-diabetes had an uncontrolled, had lower cognitive state. So if you can control diabetes, if you can control you can lower your hemoglobin A1C, you can sensitize your insulin receptors. That's one of the best protections you can get for your brain. Why? That it preferred, despite all this talk about ketogenic this and ketogenic that, the preferred fuel for the brain is glucose, but appropriately delivered glucose.
Right.
That's Can the brain use ketones under shock, under attack state? Yes. Does it prefer it sometimes yes, but it's short term. There's no data past 6 months that a keto-based fuel is beneficial for the brain. If that's the case, if 6 months and 3 month studies is your goal, I can give you cocaine, I can give you anything, and you're going to be up, or stimulants, so I'm not going to say cocaine. Now somebody's going to say I've never done that.
We're not recommending cocaine, please.
Not at all. Not at all. But what I'm saying is that short term means nothing when it comes to public health, or in fact, in health.
Mhm.
So long term, glucose, appropriately delivered glucose, bound to fiber, slow release, that's the preferred path.
Absolutely.
And like you said, if that's going on for several years, that's the best protection you can give your brain.
Yeah, and again, I agree with you. We don't want to be reductionist, but one of the quick quips I'll say is, you please don't compare jelly bean to garbanzo bean. Okay, they both may be carbs, but they're completely different
Exactly.
in every way, shape, or form. So I really appreciate your time, Dr. Sherzai. I mean, it's just been a fantastic discussion, and I do recommend people do their research and seek out the Alzheimer's Solution and the 30-Day Alzheimer's Solution, the new book by you and Dr. Ayesha Sherzai. And if there was a particular way that, because you're, as a physician and as a father, I mean, we know you have a stressful life. But you manage it. What would be you can either give a tip or what you personally do and say it's not a tip, you do whatever you think you need to do. Either one or the other, a tip for stress management. And then last, but definitely not least, is how do we get the message out? We have, for instance, in my area, I'm really passionate about diabetes. We have 90 million pre-diabetics, 80 million don't even know they have it. I don't think nearly enough people know about the relationship, the lifestyle to dementia. Oh, it's just set fate. It's just in my genes. And we know that's not the issue. So those are my final two questions. What does Dr. Sherzai either give a tip for stress reduction or does himself? And what can we do to get this word out of the power people have with lifestyle as medicine to prevent disease, and in this case, particularly dementia?
So stress management is not about meditation, mindfulness. All of those things are great. They work. They're wonderful. They give you a good link to your own biology, whether it's focusing on your breath or focusing on your pulse. It gives you awareness of yourself, which is important. Those are important things. In fact, it's critical that people develop a habit of doing either mindfulness, breathing, or something of that nature, which we talk about often. And then it's not about that moment that you're doing it. It's about becoming aware of that state that you can then apply throughout the day. So that's the point of it. But the more important way of doing stress management is the long work. Get a whiteboard or a piece of paper, sit down with your family and teach them how to identify specifically and measurably the good stressors in their life that they have or they want to have in the future. And I really mean stressors because, I want to learn guitar and I'm terrible at it. And it's a stressor, but I love it too. It's a good stress that pushes me. I have to learn, or I'm trying to learn Spanish, and I'm and to me, I'm not my mother spoke 9 languages. I'm the opposite. I don't know what happened to that gene. It just went dormant.
The same guy, right?
Yeah, it just went dormant. I mean, she could jump from language to language. So I'm trying to learn Spanish. That's stress, but I like it. It serves my purpose. That actually grows the brain. So identify specific good stressors like that, and then even time bounded. Let's say guitar. I'm going to learn 5 songs, not just through chords. 4 chord songs. How many? All of 60 songs are 4 chords. 4 chord songs from yesterday to Hey Jude or whatever it is. So that's it. That's a measurable, attainable, and stress. And that's true for other kind of things as well. Whether it's your work, specific good stressors that I want to learn to be a better speaker, and then you take a class in that. I want to do this, and so those are specific, measurable. On the bad side, this is important. What are the bad stressors in your life? And this is harder to kind of delineate and distill down. But if you get a good handle on this is life-changing because it takes some work. What are my bad stressors at work? I don't like my work is not it's not operational. I don't like this part of my work. So therefore, I'm going to work towards, and it's got to be very specific and measurable, reducing, eliminating, and delegating that. And over time, or getting a skill that will replace that. I don't like this behavior in my whole household. Our conversations with the kids, it's dysfunctional. Well, that's great. The yell at that. No. So where is it going wrong? Here. We're going to develop tools to reduce, eliminate, and so being very specific and tactical about this, it might take a little longer, but it's actually not that much longer. You change 4 or 5 key bad behaviors, bad habits, bad stressors in your life. your life is completely changed.
Absolutely.
But why don't we do it? Because all those stressors are as a big ball of stress, and they're so scary and stressful that we don't even look at it, and we go around it. Take pieces of it.
Yes.
Measurable, attainable pieces. And that's the most powerful tool you can have.
Absolutely. Yes. Otherwise, you could end up delaying and denial might be okay, but a balloon mortgage might be on its way.
Yes.
Now, how do we, whether it's, the metabolic issue, 90 million pre-diabetics, not 80 million don't know they have it. I could imagine there's probably a similar number of people who are at risk, and it may be, quite correlated with insulin resistance and so forth. But how do we get the word out of the power people have when it comes specifically to dementia? Because I think it drives people. I think, and you may know better than I, but I think it drives people more than the fear of cancer, the fear of dementia, yet the understanding that they have power in their hands. Somehow we haven't made the connection yet. You're helping so much in this regard. How do we continue in that process of awareness?
It comes to listening. So this is not in the bailiwick of most physicians, because we have 15 minutes to see a patient. And then within that 15 minutes, do the heart check, the tap in the knee, smile, write a prescription. That's impossible. So we have to go to the communities and listen. What I mean by that is how we communicate these facts to one community is different than to another community. You have to listen where the opportunities are, where you have to give information in the way that's achievable or people can actually take in, and then adjust that. Those conversations are so critical that in one effective conversation to some leaders in a community, you will have done more than a lifetime in a clinic. But most of us physicians don't have the resources or the time to do that. So what we've done is, out of our own time and our own resources, we go to the communities, and for the first several months, it's just conversations, listening and listening and listening, and then throwing a little piece of information and seeing feedback. Why isn't this work? And fairly soon, 4 or 5 touchstone behaviors, touchstone spots appear. And then you start there. And then once you start 1 or 2 of them, let alone 4 of them, all of a sudden, the momentum starts in that direction. And the community actually themselves start taking over, because they see change. They see change, not so much an outcome. They see change in their ability to make change. That's absolutely wonderful. So it's not going to be the gimmick or the app or the tool or this or that. It's just the same human thing we've done for many years, conversations.
Conversations. What a great piece of advice. Start off with listening, and then many of us in the healthcare world, we do a little bit too much preaching and not enough listening.
Like I did, right? Yeah, listening is everything.
Dr. Sherzai, this has been a wonderful conversation. Thank you so much for being a guest on News of the Day for the True Health Initiative. It's an honor to speak with you, and an honor to have you as part of the True Health Initiative. Thank you so much. My best to Dr. Ayesha, and let's stay in touch.
Thank you so much.